Hello, everyone. Students at UNE are able to do. It's a short-term immersion experience that is focused on healthcare and related services in Ghana. And all of these folks that are up on the slide here are folks from UNE who have become very committed and passionate about the program and are sort of repeat and ongoing faculty participants and also programmers, because they've been really developing a lot of good programs over there. So our last trip was 2 years ago. Obviously, the pandemic has curbed our travel for 2 summers in a row now, and it's been really hard for us not to be able to go over and see our friends and take care of the community and work in concert with other health professionals. And we're very much looking forward to going in the spring, summer of 22. We're planning on it. A lot will be dependent on how the pandemic continues to unfold, but we are very confident that we can plan and hopefully go over. The last time we were there, Dan Lambert, who is UNE's documentarian, filmmaker extraordinaire, came with us and captured a lot of the experience on film. And he developed a short film and he developed a longer film. And I think the one we're going to show you is about 20 minutes. And it really captures the goal of the experience from the vantage point of what a student would expect. And so I think without further ado, I'm just going to have Dave Daddiego play it, and then we can talk a little bit after.
We're in Boston right now. We'll be flying to Portugal. That will be our next stop before Ghana. We just got to Lisbon, Portugal. We have about a 4-hour layover. We made it to Ghana!
On our bus ride in, though, I was a little bit shocked at the living conditions that we had passed.
First, I would say it was extremely hot, which I expected, and very humid. The city was a lot bigger than I expected. I don't know why I expected it to be a lot smaller, but it was huge.
I thought the only surprises really were just the amount of goats and chickens that are running around.
First impressions, very different than anything I've experienced.
I did have some culture shock. It was far from what I expected it to be and what I imagined in my head. And even though I have prepared a little bit, especially for the clinical aspect, I don't think you can really prepare.
I'm excited, honestly. Was kind of tired last night, got a good sleep. Woke up to some roosters crowing this morning. I'm very excited for what the week has to hold. I think that we're going to get a lot done, meet some cool people. I think we have a lot to learn.
We definitely turned the clinic around. It was a bare, empty church. And then I felt like before I knew it, seats were filled with patients.
I think that we're getting along really well. We got some PT students.
What do you think is contributing to your back pain?
Pharmacy.
Have you ever breastfed?
Public health.
Did they treat you with respect?
Social work, as well as nursing. And it's really just been great to kind of get everyone working together and the gears are meshing.
I guess I just hope to learn how people here have become so resilient, how they get through some of the things that they're faced with, and maybe bring that back to my own life and some of the patients that I work with to teach resilience.
Today we kind of saw it coming together in the clinical a bit, helping each other out. I do believe that throughout the week it's really just going to become like a well-oiled machine.
The Ghana Cross-Cultural Health Immersion program was born of a chance meeting in an airport in 1993.
I had the opportunity to travel to the US for the first time in my life. It was quite an adventurous journey. God was with me.
Lita McHenry, a registered nurse and longtime faculty at the University of Massachusetts Amherst, and the Reverend Robert Ando, a well-known pastor in Ghana's western region, struck up a conversation that led to a long-lasting partnership. Ando and McHenry envisioned an equal exchange of knowledge and culture that could benefit both sides. They worked out a plan to bring UMass faculty and students to Ghana, in partnership with the Ghana Health Service and the local University of Cape Coast. When McHenry retired in 2008, she looked to former UMass doctoral student and mentee Jennifer Morton to take over administration of the program. Morton was by then on the nursing faculty at UNE, and McHenry was intrigued by UNE's interprofessional approach to health education and collaborative care. Perhaps more important was the philosophical alignment between the two women. McHenry trusted Morton to continue to lead the program according to its original vision.
I knew when I became a faculty member that this was something I wanted to continue, and I wanted to follow Lita McHenry's legacy in exposing students to something so important.
We're hoping to see at least 50 people today. We have some of the nurses over here. Yesterday, unfortunately, our blood pressure machines weren't working, but they got them all up and running now. They're very excited. We have our pharmacy students over here. We got some more medication last night, which is super exciting. We have our physical therapists over there getting ready to teach some exercises. And we have an optometrist up there. And social work will be doing some exit surveys. And we also have public health. We're doing some research, which will be really exciting to see the results. So we're excited for today and hope we can help a lot of people out.
I'm Katie. I'm at the nurses station here in Ghana. I'm with Owen. And I'm at the lab station, so we're testing for malaria. We're drawing blood sugars. We're doing urine analysis, checking to see how people's kidneys are doing, making sure they don't have diabetes. People here, their blood sugars, blood pressures seem to run a little bit high, so we're trying to get an idea of that and keep everything under control. And if we see some numbers that we don't like, we'll send them over to pharmacy.
We're running into a lot of infections and skin infections, upper respiratory infections, lots of anemia. We're seeing a lot of pain, and so we're just trying to really prep, and that way we can stay ahead of the game a little bit. We've labeled a lot of things, prepackaged lots of pain medications like ibuprofen and Tylenol.
And did they ask you to follow up at a hospital or go get more medicine?
What we do on day 3, once folks are comfortable with the flow, is we start interchanging students in some of the different areas so they get an experience of what the different disciplines have to offer. For example, a nursing student may cross-train over in physiotherapy. Physiotherapists may cross-train over in intake. Nursing student may spend time doing pharmacy technician work in the pharmacy. All of these things are important as students learn to really understand what the roles and responsibilities are of other health professions disciplines.
I've done some traveling, but never with my nursing skills that I've learned at UNE. And Maine is really becoming diverse, so I think it's kind of important to have that cultural sensitivity going into my profession. We've been doing clinic for about 4 days now, and it's been a really great experience so far. At first I was having a little bit of spiritual issues because I kind of came here and I didn't really know what to expect, and from seeing all the patients and what was going on, especially little kids that had some malnutrition, I felt like, why do I get to live the life I live?
Can I hear you? I think I already did your assessment. Ready?
And it was really helpful to have my teachers and my colleagues here to be able to debrief that, because it was really a bad feeling that I was feeling. And then after talking about it, I felt so much better.
I think though what you really have to do is come here and just look at it through the context of community and the richness of their culture and how much they know one another and celebrate and are just more or less a very happy population. And I think those are values that you can't put a price on.
Now, even at the halfway point, I already have a completely different outlook on everything.
I've definitely grown a lot in the last 4 days, and it's crazy to think that it's only been 4 days because I feel like so much has happened, and it's just really made me grateful for where I come from, and also grateful for the experience to be in a different culture and to be living amongst these people who are so beautiful and welcoming.
Ghana, situated on the Gulf of Guinea in West Africa, was the first sub-Saharan African nation to achieve independence from colonial rule. Ghana's 28 million people comprise several native groups and a rich and diverse cultural life. Sekondi Takoradi, a port city and commercial center in Ghana's western region, is the country's third largest metropolitan area. While clinical work is the priority, the Ghana Immersion program recognizes that people's health is tied to their culture and community. Whenever there's free time, students and faculty embark on day trips and sightseeing excursions, where they learn more about Ghanaian history and culture.
The Elmina Castle, I think, fostered a sense of self-reflection. Also being there and all the history that it holds is more or less haunting.
Something I really enjoyed was seeing the art, just beautiful paintings.
What does your school day look like? We learn a lot, and then after the learning, they break us a little to go and refresh our mind.
Well, I'm so happy to be here and to meet you all. Thank you for having us.
Oh, thank you.
It was beautiful. We got to run in the ocean and take pictures. Amazing food.
we're very excited and very grateful. We all got a traditional Ghanaian ensemble, and we're very, very grateful that we're all given these. We're going to be able to sing and dance and sit side by side with all the Ghanaians this morning.
Reverend Ando has Ghanaian dresses and shirts made for all the female and male students and faculty, and so we attend the service. It's a very heartwarming experience for our students, faculty, as well as the community.
After a week in Reverend Ando's home base of Secundi, the team headed out to the rural towns of Consoarado and Diabini to help expand healthcare access to these more remote communities.
Hi, it's for a community health worker, physician assistant, and we are at Consoarado, and this is day 5. So we are here to attend to those from the villages.
The rural sites are an important aspect of the partnership. They allow students to assess the differences between patient populations. For example, patients in the rural communities tend to be sicker, especially in Consoarado. And the urban patients in Secundi Takoradi tend to have higher rates of being insured. The Immersion program is built around the equal exchange of culture and knowledge. As Director Jennifer Morton says, our purpose is not to impose Western healthcare. Students come to Ghana to learn, and to that end, the relationships they form with the Ghanaian partners are invaluable.
Denise.
Working with members of Reverend Ando's congregation, as well as medical professionals from the Ghanaian National Health Service and the local Cape Coast University, students are guided across cultural and language barriers and introduced to new perspectives on health, medical care, material wealth, as well as many practical lessons on providing care with limited resources.
I think it's a win-win situation for both communities, I would say. For the students coming down, I think I've seen lots of them the first time in Africa, first time in Ghana. They're meeting different cultural setups and what have you. But for the community here in Ghana, knowing our health system and its challenges, I think it's been positive and it's impacted.
Good. For the students that come here, I believe it's an eye-opener to some of the tropical conditions probably we'll never see in the UK or US, and it's an experience that others who haven't been here may not have.
But the edges are all undermined, so it's never going to heal.
It looks like it's healing, but what he's saying is the bacteria, like until that bacteria gets treated with certain antibiotics, it continues to undermine the surrounding tissue and it won't actually get better.
So they will get to learn a lot from the patients, and also it will give them a different idea about what health is. The stories, the touching stories about the patient, why they have that condition and what they are doing about it, and the fact that because of their financial situation, which has landed some of them in such condition, when they leave here, give them a very different experience. They begin to become very connected with their patients.
This is for your cough.
Along the way, many lifelong friendships are made.
We're staying in pretty close quarters, me and some of the guys, so we've been hanging out quite a bit, and they've showed me around Secundi a bit and really got to walk around, try some local flavor, watch a couple football matches. It's been great. We've really been getting along well and just meshing well.
they've been very great, especially Owen. It's as if we've known each other for a very long time, and it's just 2 weeks.
Canso Arado and Diabani were selected as locations for the rural clinics, in part because of the Reverend Ando's long-standing relationships with the paramount chiefs of the two communities.
This way.
You have been giving us hope. And also we are strong now. Your medicine is very good. So you are helping us very well.
Then make and work as you born every year go on to have to tools said to me was papa one could one born then the mara one could one born and bribia or the mala among us in the age one kahin to me was papa come then was papa when where you born 10 years or more than that what about boy.
A highlight of the program is the annual performance of the Ghanaian dance and drum troupe, Obrempong. Working in the style of what is called Gahu music, with 6 distinct percussion instruments, the troupe performs dances associated with local tribes and festivals.
Well, it confirmed my suspicion that I'm a terrible dancer. Their performance was awesome. It was really something that I've never seen before, and so being able to experience that and see them in the traditional garb, and it's good music.
The celebration is the joyful and emotional climax to a rich and eventful fortnight.
And it's reaching to the highest mountain, and it flows to the lowest valleys. Oh, the blood that gives me strength from day to day.
I feel like the love and joy and laughter that we all share here together is something that I don't experience often. It is such an amazing community of people.
Thank you for welcoming us into your community and treating us like family. It's been the best 2 weeks ever.
Everybody here, I want to say a very big thank you to all of you. We want to see you back again. So that's all. God bless you. May that stay.
What a great group, really. It feels like we're all family right now, and it's a great feeling. And just thank you all for opening your arms and taking us in.
The last couple weeks have been amazing. I feel like I've grown professionally, emotionally, mentally. It's been a really great experience. I'm kind of sad to leave, but I'm also looking forward to going home with a new outlook.
I think the things I'll remember most here are the connections I've made between the community health workers, the students and the professionals from Cape Coast. We've just learned so much from them, and honestly, I think we built really good friendships.
I have a new outlook on everything, and I'm excited to make some new changes in my life that I've picked up from this experience. So happy and sad at the same time.
I've also really gained such a respect for the healthcare professions out here, and from what they've been able to teach us has been immeasurable. It's a completely different game out here with what they have to work with, and I have nothing but gained respect for how they go about their day.
And it really feels good to have UNE around, you know, to the students, teaching them. I'm also learning from them, the American culture, Ghanaian culture. We talk, it's so nice.
We've fallen in love with them, and we wish they would come back and learn more.
We want to say we are indebted to the school for allowing us to work hand in hand with these wonderful people that come our way under the leadership of Dr. Jennifer.
Our last day in Ghana. This has been an amazing, humbling, emotional experience for all of us. I think we would all say that we're coming out of this changed.
God bless you. I hope to see you all very soon.
Have any of you had a chance to see this film yet, or is this the first time? Dan did an amazing job capturing the experience. What I plan to do for the rest of our time is just talk a little bit more about the clinic operations. I also have colleagues here that have all been, some many times, and so I think it's important for them to share some of the experience as well. How many of you have traveled for some sort of a global health experience? Good. So this isn't new to you, and I'm not sure what the context was that you were going, but this context really has been derived from the philosophy that my mentor passed on to me, and that is that these sorts of experiences can't be clinical tourism. They must be partnerships, and those partnerships are built on a lot of trust. And so we've been working toward that goal for almost 20 years now. Sekondi, the city that we travel to, is the third largest urban area in Ghana. The twin cities of Sekondi and Takoradi have about 1 million people total, but it's all very concentrated. And so when we say we go to rural areas to provide care, they're really outside the city limits, but incredibly rural. They're like two countries that have very different needs. The rural areas, I had mentioned that people tend to be sicker. They tend to have illnesses that often can't be cured, and we see a lot of suffering in those areas, and that's one of the reasons we love to be able to partake in both demographics. And so traveling to Ghana as a health profession student is like walking into a social determinants course, so to speak. We know what we have around us, or we at least have a pretty good contextual appreciation for what's around us and what people need in this community. But traveling to Ghana, which is really considered a low-resource country, we don't like to use the terms third world or even developing anymore because they have a pejorative connotation. But it's a very low resource area where many people never see health providers. And so being able to partner with the Ghana Health Service has been a very unique a unique experience for students because they're learning about healthcare according to a clinical practice guideline of another country. And it's all evidence-based according to their context. So many students will say, and I know we have a mixture of folks, but nursing students will say it's the best health assessment course they ever had because they don't have the technology to be able to make spot assessments. You have to listen a little bit longer. You are talking through an interpreter. And so there's a lot of visualization as well as listening that helps all health profession students make assessments. You could see that we set up in a church. Students stay in a church setting. It's not considered a faith-based experience, but faith-based entities represent how these sorts of things can roll out. For example, Reverend Ando has a very big compound, and so not only do we all stay there and eat there and sleep there, but we also practice there as well. We use the church rectory set up as a mobile clinic, and it's set up there for the duration of time that we're there. We fundraise and bring over a lot of supplies. We also purchase a lot of supplies over there because it helps their economy. As I mentioned, we stay in that area. We run clinic from about 8 in the morning till about 1:30, 2 o'clock. And the reason it's shorter than one would expect is because part of this experience is that we want students to get out and immerse themselves in the culture. You know, having cultural awareness and understanding of what's around them is going to support the care of the patients. And so this 2-week experience is very foundational on not only healthcare, but also cultural immersion. I heard a student say, the food is amazing, and I think it is. Ghanaian food has a very, it's a very interesting, it's a lot of stews, a lot of heat in terms of pepper, and a lot of rice and beans, and very minimal protein in the way of animal protein, simply because that sort of thing isn't widely available. A lot of the protein comes from beans. We have brought students from every health professions major. Our largest program participants have been nursing, social work, physiotherapy or physical therapy, and pharmacy. Those tend to be the pockets of students that spend the most time, but no student is turned away for being in a major that hasn't been an active participant. So that's been really quite amazing. It really started out 20 years ago as a nursing experience at UMass Amherst, but now it's interprofessional and quite valuable in all of the services we've been able to provide. You probably saw an optometrist. Seti was on camera quite a bit talking about the close relationships he's garnered with UNE students. But one of the fundamental game changers in terms of the care that we can provide is that we've partnered with the Cape Coast University Optometry Department, and we have been able to secure glasses that we bring over that, let's see, they can measure up to 3 positive 3 diopters and negative 3 diopters, which for a person with vision disparities over there can be really life-changing for them. We've been able to get teachers glasses, folks that really need to work to make an income but have not been able to get glasses. We've been able to do that, as well as caring for other health needs, chronic disease, and doing a lot of health education and promotion. Would one of you like to talk a little bit about the experience from not only your discipline, but also personally? Rachel? Come on. And maybe you can even talk a little bit about the service learning activities.
Oh, sure, yeah. Definitely. Yeah. Yes, I feel like that video absolutely captured the experience so well, so it's difficult to elaborate on it any further. It's one of the best experiences I've ever had, and it's just a totally different health learning experience than you would gain, from being in any type of practice setting here. So from a pharmacy perspective, the first year I went, I was incredibly intimidated because even, for example, conditions that we treat commonly here, like high blood pressure, they have different standards of care over there. And so we're utilizing different medications, but also they have, different conditions and diseases that we don't necessarily see a lot of here. So a whole different amount of medications that we don't ever prescribe here. So from a pharmacy perspective, it was an incredible learning experience. And absolutely, yes, we're learning just as much, if not way more, from the health professionals there than we are providing to them. So we have a pharmacist that we collaborate with over there, and several pharmacy technicians and community health workers that help us order the medications, learn about the medications, help to translate to the patients, and it's amazing. And so to add on to that, we've had some time now to sort of gather what our needs in the pharmacy area are. And so we're working on a project. It's going to be an interprofessional project, and we are happy to have any professions join. Right now we have pharmacy students, masters in public health students, and nursing students. And we are going to work to do a couple of different things. One, we're going to redesign their medication labels. I think we have a pretty good medication label right now, but we want to make sure that we are up to the standards with that, and that it's optimal for translating and optimal understanding. So we're going to be redesigning that. We're also going to be trying to create, the idea was to think of some of the common conditions that we see over there, one being malaria, which I think we're going to focus on first, and to make sort of like a patient pamphlet that really describes, all aspects of prevention and treatment, and also outlines the complex medication regimen that is given when you have malaria. So we're going to work to develop a pamphlet that can be easily translated into their native language. And then also Jen just gave us the wonderful idea of putting together some rehydration packets. So that's something that we really commonly disperse. So dehydration, we see a lot of malnutrition, and also pain. And so these are things that we try to put together before we go. And so we're going to put together some of those rehydration packets too. So if you have any interest in getting involved in any of those projects before we go, reach out to Jen or myself, Rachel Mayer, rmayer@une.edu, and we'd love to work with you. Yeah.
So would you like to say a few words before we open it up for questions, or is it great? Thank you. This is Kelly Fox from Social Work.
So social work is really not much of a thing in Ghana. When you are in a low-resource country, I don't think there's a whole lot of opportunity to think about one's mental health, which honestly I really learned while I was there, and also while I traveled to Nepal years ago, that ability to be self-reflective in that kind of a way is really it's really a luxury. What social work was able to do while we were there is we spent a lot of time doing exit surveys, and I worked with an informatics person from Cape Coast, and we started to gather some data about what the most common conditions were, which practitioners people were seeing, so that we could begin to gain more of a profile of what folks were doing. The cool thing about social work is that myself and the student often had an opportunity to meet every single patient that left the clinic because we were doing those exit surveys. So that was a really cool thing. Also, as social workers, we had an opportunity to sort of get to know people. I think you saw Cassidy sort of interacting and intermingling with folks and really getting to know folks, talking to children. And so I think, social work has a really unique opportunity. I think as a faculty member, one of the most amazing things is really watching the students learn. You can start to see, once they get past the exhaustion and the shock of being there, I think there is this sense of unbelievable absorption of things that they couldn't possibly learn in a sterile clinic, perfect environment. And I really do think it stretches students amazingly. And as we were beginning to talk about this today, I started to feel a little bit choked up because this experience has meant so much to me, and the ability to go back this coming year is really important. And I've made some really great friendships. One of the best moments was in the clinic in Diabini. The first year we were there, I met a woman who had a young child who was very ill with a seizure disorder. But she came to the clinic without her son. Somebody was watching her son, and she calls herself a mental health practitioner and sort of a counselor. And she came in, and it looked as if she were holding a church service as she was unfolding and talking to folks at the clinic while they were waiting about mental health issues and about mental illness as sort of as a normal kind of a thing. And she was actually talking about post-traumatic stress disorder, which was kind of amazing. So although she was talking about those things, it was interesting that the response of folks was a little bit limited, but it was very basic information. And I just was really amazed with the way that she really talked about it in a sort of as if she were preaching. And that was a really cool experience. And she's become a very dear friend with her two little munchkins. So
I know we're getting to that time where people need to think about going to class, but we'll talk a little bit about the application process, but I thought I would just open it up in the event that you have any questions about anything that you saw or heard from us first. Any questions? Yes. How often do we have dental students? So that's one health profession that that hasn't come with us. I think part of it's being the newness of the school. We have had dental hygiene students come, but we would be very open to having dental students come. There's tremendous need. There's not a lot of preventive care happening from the dental world. If a person has a toothache, it tends to get pulled. But there's really some very interesting learning along the lines of dental health there. People still use toothsticks to clean their teeth as opposed to toothbrushes, and they work really well. As a matter of fact, I think it was Tufts did a study several years ago comparing the two, and the toothsticks were better. And I'm not sure all the variables that were involved, like technique and things like that, but it was very interesting. So we'd be very open for dental medicine. Other questions? Yes. So we have worked with a local dentist in Secundi, and the last time that we had an interface was quite a few years ago. So if we knew that dental students were coming, we would be doing the research quite early to get that in place. And we'd also want a faculty member to be involved in that process as well. Other questions? Yes. I'm sorry, can you say that again? I know. Sure. Are you nursing students? I have all your names. I'm going to email you. Rachel, have you determined the times for the service learning piece?
We do have our first meeting scheduled. I believe it is for, let's see. Yeah, it's October 6th, Wednesday, October 6th at 12, so 12 to 1. That seemed to be Wednesdays at noon, seemed to be the time that worked for our current students. But if we get other students involved, we're definitely willing to shift that. We envision that like a lot of the work will take place. Well, first, the collaboration will have to happen to divide responsibilities and duties, but then you won't have to always, meet. And the meetings will definitely be on Zoom, too. Yeah.
So I'll forward that today. Yes, sure. So the time frame that we go is generally the day after or 2 days after graduation in the spring. So this year it would be probably around the 23rd of May. And we stay anywhere from 12 to 14 days. So we're usually back the end of the first week of June. And that's a really good time. As far as leniency with professors, every department or school kind of treats this a little bit differently. Some accreditation bodies will allow this to be clinical time. Others won't. So it really is a matter of getting a faculty member invested in having a discussion. And that would determine how this could be treated. In nursing, we have, for our traditional students, they're off in the summer, but for our accelerated program, we've been able to make it work, even though they are just starting a brand new semester. So different departments will help make it work. But it's not one-stop shopping for everybody. And we start looking at, actually, Tricia, do you want to talk a little bit about the application process? Thank you.
It's hard to watch that video and not immediately want to go and sign up. So we have an application process for this program. And usually the application will open in January or open in December, and then you have time over the break to apply. It is an online application. You will need to think about getting a passport because you will have to have a valid passport 6 months after you get back. So the trip will likely be, as we spoke about, at the middle to end of May for 2 weeks. So check your passports now if you are interested, and either renew or apply so that you have a valid passport ready to go, because you will need a visa, so that process takes a little while. So that's one thing I always tell students in advance, to have that ready to go. You'll need faculty references, you'll write an essay. I will tell you, we also have a very generous scholarship pool for students in the Westbrook College of Health Professions that can help contribute to the cost of the trip. Also through GAPSA, you can apply for funding through GAPSA to help cover the costs of the trip as well. It is a one-time fee that is billed to your student account as a lab fee, and it covers pretty much everything. So it'll cover your flight, your accommodations, your transportation, your food, your laundry, your excursions. Pretty much what you need to bring with you is just some spending money to buy lots of local crafts and art, which you'll want to do as well. I'm happy to answer questions students have about the trip. Our website online has a great overview of the daily schedule, the kinds of activities, packing lists, pretty much everything you need to know. We try and review applications and get back to students a couple weeks after the deadline. And after that, we will meet as a group a couple times before the travel. So you'll get to know each other, you'll work together as a team, there'll be some reading to do. It's a really unique and fantastic experience, as you can see from the video. And we look forward to working with you and hearing from you about any questions you might have about the application process or the trip itself.
One other thing I wanted to mention, and things have changed so much in 20 years, but the Wi-Fi is getting better and better every year, and so if students do need to bring some work with them, not only is the possibility of Wi-Fi better, but there are internet cafes also, and there is downtime. Oftentimes people have a hard time trying to do schoolwork, but if you have to, it's possible. And I saw one more question over here. The price of the entire trip, it's kind of a moving target, but it's, what, around 32? It's around the same time, I think. Yes. Yeah. Well, thank you very much, everyone. Have a great rest of your day, and don't hesitate to reach out if you have questions.